We'll begin with Mr. Gansler on this, and then Mr. Brown and Delegate Mazier. And the question is on the health exchange. Do you support the administration decision to rebuild the health exchange using Connecticut software?
Well, the health exchange, Jeff, is the major difference, I believe, in this election and what has happened and where we're going with it. You know, I chaired President Obama's campaign here in the state of Maryland. Other people went a different direction. I went to the Supreme Court of the United States to uphold the constitutionality of the Affordable Care Act. I believe health care is a right, and I believe that it was wrong that we're the only country in the nation, in the civilized nation, that didn't provide health care to its citizens. That said, we have given $200 million to the lieutenant governor who, by his own admission, was in charge. This was the one thing that he has been actually managed or has been in charge of or was supposed to be the leader of during his 8 years as lieutenant governor. And as the Washington Post has said, as the Baltimore Sun has said, it was a national embarrassment. We're 45th in the country in enrolling people into health care. And he'll get up here and spin the numbers, and he'll take the Medicaid automatic rollovers and say, well, we've gotten people health care. The fact of the matter is we have hundreds of thousands of people without health care in Maryland. People who can't take their children to get chemotherapy, people whose grandparents can't get access to health care, real people, not to mention the $200 million down the drain. The problem with Connecticut is they once again went into a closed room, no transparency, no competition, and are chasing good money after bad. And even the people in Connecticut say that this won't work. I called for moving to the federal exchange, which works, which had problems at the beginning and now has 50,000 people a day enrolling, and that's what we need to do.
Mr. Brown.
Good. Thanks, Jeff. I'm not new to health care, and for the last 8 years under the O'Malley Brown administration, we've expanded access to affordable quality health care to over 500,000 Marylanders. And when we set out to launch the Health Benefits Exchange, just like when President Obama launched the federal exchange, just like when every state launched their exchange, to tremendous technical challenges, there was nobody more frustrated than me with the troubles that we experience. And I sincerely regret that any Marylander had difficulties, like many did, to access affordable quality health care. But that's why we took the actions that we did. We reorganized the leadership at the exchange. We refocused the vendors, including IBM. Some of them were fired from the job. We looked at the resources and the capabilities of the exchange, because the exchange is more than a website, and we plussed up call centers and navigators around the state. And the result, our goal was to enroll 260,000 Marylanders. We enrolled 340,000 Marylanders. The question was asked before about poverty and low wages. Of the 340, about 260,000 are Medicaid recipients. That's America's health insurance for the working poor. That's that single mom who is making minimum wage, who was priced out of the market because her child had a pre-existing condition, was paying $850 a month 6 months ago. Today, she's paying $175 a month. That's the work we did. Marylanders wanted to see leaders who did the hard work, took on the problems, even the problems that arose.
Sir, your time.
And got the job done.
Delegate Mazier.
Professionally, I'm a healthcare policy analyst. I worked on Capitol Hill for nearly a decade working on healthcare policy issues. And I've always believed that healthcare is a right, not a privilege. And I am a strong supporter of the Affordable Care Act because for years I had been working to try to get some of those very same provisions passed here in Maryland. The first piece of legislation that I got to sign into law was a bill that allows young adults to remain on their family's health plan through age 25. It's now federal law because we were able to show how it worked in Maryland first. And in each of these instances, whether it was finding a unique way to enroll 50,000 more children in health insurance through my Kids First initiative, or working across the aisle to come up with a bipartisan solution to give 35,000 more women in our state access to free family planning. In each and every instance, I learned that the most important thing wasn't just passing the law. It was to make sure that we got it implemented correctly, that the unglamorous side of governing was just as important. Our ideas and our vision matter in this election, but our track record of implementing laws successfully matters more. I'm the governor that will make sure that we get this right. Healthcare should be a right for everyone, not a privilege, and under a Mazier administration, we'll get it done.
I have the ability to ask periodic follow-ups here, and I'm going to ask you one, Lieutenant Governor, on this. You talked about your work in straightening out the mess, replacing staff, and deciding to move on. Let me read from an editorial that was in The Sun this morning, which asked some of the big questions remaining for the three of you as candidates. And Mr. Brown, the question was, we still haven't gotten a truly satisfactory answer about what exactly his role was in managing the launch or in making decisions about how to fix things when they went awry. Was he a failed manager, or was the talk of him being the state's point man on health insurance political puffery that went horribly awry? Can you help us understand, maybe on a scale of 1 to 10, where 1 is out of the loop, 10 is you were in charge?
Let me describe.
How much in charge were you?
Let me describe my role. Implementing the Affordable Care Act, the big component, of course, was the health benefits exchange. But there's also the Medicaid expansion. There are issues that deal with the workforce and making sure that we have a health provider workforce to do the work. Also, there are questions that we looked at in a work group we put together dealing with the safety net. So as more and more Marylanders get health insurance, there's still going to be some that don't. So I was the chair of the Health Reform Coordinating Council that looked at every one of these aspects. And one of the first things that we did 3 years ago, we sent to the legislature the blueprint for establishing a health benefits exchange. And we established it as an independent government agency. In retrospect, like in Connecticut, I'd go back and say, appoint me as a member of the health benefits exchange, maybe even the chairman of the exchange, but that's not the role that I served. But that doesn't mean that I didn't have a responsibility. I was chair of the Health Reform Coordinating Council. When we got the information that we did, and I didn't get it till after October 1st because I wasn't on the health exchange where the information was had. As soon as we got the information, then we brought the exchange in and said, okay, we've got some things that you need to do. Reorganize the leadership, refocus the vendors, get rid of the ones that aren't working. What more resources do you need? So we need more call centers because we're doing more manual workarounds. We need more navigators, and that's what we did. And we did a lot of manual workarounds, but the result was to enroll 340,000 Marylanders. These are real Marylanders. You know, this is the senior who's no longer making the choice between prescription drugs and groceries. These are real Marylanders, a lot of manual workarounds.